The Royal Wolverhampton NHS Trust is pioneering an integrated care project called Vertical Integration. It's a groundbreaking project for healthcare in this country, which sees 3 local GP practices working hand in hand with the Trust. The surgeries are Alfred Squire Road Health Centre, Lee Road Medical Practice and MGS Medical Practice at Bradley Heath Centre, Ruskin Road Surgery and Low Hill Health Centre. The practices and the Trust believe this new way of working will increase access to services, provide better care and reduce the red tape between the surgeries and the hospital. And this is why. Sultan Mahmood is the Trust's Integration Director leading the project.
In 2014, NHS England and Simon Stevens released the NHS 5-Year Forward View, which really set a challenge to the health service to find new models of care to deliver services in a more streamlined and efficient way, in a more patient-centred way and in a way that's more sustained. We locally in Wolverhampton have picked up the baton. 3 practices, which account for about 10% of the population here, have decided to vertically integrate with Royal Wolverhampton NHS Trust.
For Chief Executive David Lawton, VI is about simplicity, about being better for patients, better for the NHS.
The idea is quite simple. We've identified 5% of the patients in those practices that are consuming an awful amount of resource, both in primary care and secondary care, and we're going to work with those patients to provide better services to hopefully keep them in primary care for as long as we possibly can without coming into secondary health care. That will be better for the patients and it will be better for the NHS as a whole. It is exciting in terms of working with those GP practices. The relationships have already improved enormously and we're aiming to provide a much more seamless service.
And what do GPs think about leading the way in care innovation?
It has taken 8 or 9 months to get to this stage with close discussions with Royal Wolverhampton Trust, NHS England, Wolverhampton CCG, Public Health, Health Watch and our patient group, who are all very supportive and excited about this new project. The main aims and goals for all of us involved in this project is to improve patient access in primary care, to improve patient outcomes in Wolverhampton, to have a better integrated care system across primary and secondary care, and all the investment into this project and the efficiencies made will be reinvested in primary care to improve services for our patients.
This is a really exciting project and we're very pleased to be involved. 3 practices are joining up with RWT to improve primary care and improve that interface between primary and secondary care. So we're really hoping this is going to improve the care of patients' long-term conditions. We're hoping it's really going to improve emergency care and we're really hoping it's going to improve access in primary care.
Of course, the NHS is all about the patients, about providing high-quality, safe care for everyone, and that's what VI is all about too. Sylvia Bentley is a member of the Patient Participation Group at Alfred Squire.
As a member of the Patient Participation Group, I'm extremely happy with what's happening with our practice. It's going to be a big benefit for us. Things aren't going to change initially, but at the moment it's a good thing for our practice. We're still going to maintain our excellent doctors and our staffing will all be exactly the same as it has been. So to us as patients, it's going to be a very good thing.
Over at Lee Road, vertical integration is also being warmly welcomed by doctors and patients alike. Dr. Mona Sidhu says it's all about working together.
The key benefits that I see for patients are A, increased and improved access, second, improved communication between primary and secondary care, and improved patient experience by various ways, including shared patient records and removing the artificial barriers between primary and secondary care.
Retired Dr. Len Moore has seen a lot of changes in the NHS in his career. He is now chair of the PPG at Lee Road. He thinks there are exciting times ahead.
From the point of view of the Patient Participation Group, we see this as a very exciting project. The NHS is clearly under enormous strain at the moment, and we need to find new innovative ways of working together to improve patient care. This is the way forward here in Lee Road in Wolverhampton. So I think over time, as people work together again, there will be new advantages that people discover from that shared experience of looking after people. So we're looking forward to this with enormous anticipation for the future here at Lee Road Surgery.
Vertical integration, giving you the right care at the right time, in the right place, from the right healthcare professional.